With the outbreak of the COVID-19 pandemic, e-learning has emerged as a critical instrument for sustaining educational efforts. Nursing students who were taking up online classes were strongly encouraged to make use of their online library resources, particularly the use of ebooks. Good day, classmates and clinical instructors. We are the Group 1B from BSN 3F, and we are happy to present to you our qualitative research entitled Perceptions of Nursing Students on the Use of Ebooks for Learning Enhancement. I am Anette Cabalfin, and together with me are John Botalon, Chrisjan Caraig, Chrisjan Cepeda, and Therese Chua.
Now, let's go to the objective of this study. The purpose of this study is to explore the different perceptions of nursing students on the use of ebooks. This study utilized a descriptive qualitative research design because it is a qualitative in nature, for it aims to describe accurately a phenomenon, population, or situation. This type of research design was particularly successful at bringing to the fore the individual experiences and the perceptions of nursing students on the use of ebooks.
For the study sample, a total of 6 nursing students who agreed to participate in the study were selected according to the certainty that they will accurately describe their perceptions and experience in using ebooks. The purposive sampling method was employed in choosing the participants based on the following inclusion criteria. First would be the student must be enrolled in the second semester of BSN program of the university for school year 2021-2022. Second would be the student must either be a male or female nursing student. Third, the student must have an experience in using ebooks.
Now we proceed to the instrument used in the study, which was a semi-structured interview guide. The semi-structured interview guide is considered to be effective in establishing reciprocity between the interviewer and the participant. It allows the interviewer to improvise follow-up questions depending on the participant's response, giving the participants more room to express themselves verbally.
For the results of the study, a demographic profile was utilized to further assess the result of the research and the relevance of the topic to certain respondents. This includes the participants' names, whose identities were not disclosed. Pseudonyms were employed using the first name of the characters from the movie Jane Doe. This also included the participants' age, sex, and year level.
For this study, a total of 5 themes were established. Theme number 1 talks about the perceived hindrances in using ebooks. So this particular theme has 4 categories, which are the following. Category 1A, challenges on connectivity. Category 1B, distractions can be an inconvenience. Category 1C, prolonged usage of e-reader devices causes eye strain. And Category 1D, scrolling through demands for more time. So there is no denying that ebooks are one of the few internet channels that students are using nowadays. But there is also no denying that it is not without flaws. So as a result of the pandemic, nursing students have encountered problems and faced concerns relating to their learning outcome. The participants of the study stated similar perceived hindrances in using ebooks. One notable hindrance, as mentioned by a majority of the participants, is that they are more prone to experiencing eye strain or headaches as an accumulating effect for reading too long.
Now we continue with theme number 2, which is the interesting features of ebooks. This particular theme has 3 categories, which are the following. Category 2A, advanced features of ebooks. Category 2B, easier, highlighting and referencing. Category 2C, side notes and annotations. The participants of the study shared a variety of features of ebooks in which they find interesting. As the number of people who read ebooks grow, so are the benefits. With a growing number of tech-savvy individuals, every service provider is digitizing its services in order to meet the needs of this big group of digital consumers. Ebooks provide learners, lecturers, and universities with an extra tool of instructions that can encourage or improve the learning process.
Now we proceed to the third theme, which is the comparison between ebooks and traditional printed books. This particular theme has 5 categories, which are the following. Category 3A, retainment of information. Category 3B, quality of reading. Category 3C, different sense of feeling. Category 3D, space consumed or physical storage. And lastly, category 3E, cost and expense. The participants of this study cited similar comparisons about ebooks. Ebooks have been a controversial subject among students, as there will always be those who will favor physical books over digital ebooks, or vice versa. The participants of this study reveal that traditional books are still dominant and more reliable compared to ebooks.
Next, we have theme number 4, which is the impact of ebook usage on learning outcomes. This particular theme has 4 categories, which are the following. Category 4A, positive perceptions of ebook usage. Category 4B, effective method to improving study habits. Category 4C, helpful and beneficial in fulfilling academic requirements. Category 4D, a good alternative to printed books. Ebook is an essential tool for users when it comes to learning, especially students who want to learn and utilize their knowledge in using technology. The participants of this study share the positive impact of ebooks when it comes to the learning outcomes.
And lastly, our theme number 5 talks about the desire for better access of ebooks. This particular theme has 3 categories, which are the following. Category 5A, limited resources. Category 5B, the need to physically own an electronic gadget. Category 5C, the need to install appropriate software. The participants of the study stated similar perceived desires for better access of ebooks. There is no doubt that ebooks have changed the game for online learning, but we cannot also deny the lack of ebook resources, complete full version access, appropriate software, and easier access to it. This becomes a challenge to students that are bombarded with schoolwork every single day.
For our conclusion, the findings of this study support the perception that the nursing students' use of ebooks has a both favorable and unfavorable effect on their learning enhancement. The result from this study provided an overview of the various perceptions of nursing students presented in 5 thematic insights, which were mentioned earlier.
For our recommendations, the implementations of this study should take into account that students should be able to purchase ebooks at a lower rate through educational institutions. With the shift to digital ebooks, the findings of these studies suggested that greater efforts should be made to encourage the students to enjoy reading ebooks and value their benefits. Perhaps purchasing ebooks resources ahead of time and providing the students with access to these will achieve it. Academic libraries should also continue to develop digital collections and enhance their online services to improve user experience. Adding more ebooks to the university's online library and actively advertising this to social media like Facebook or Instagram may allow the students to engage more in utilizing them instead of ignoring them. Lastly, more studies needed to explore how ebooks can match students' expectations and improve their learning experience with them, and more data must be collected in order to offer credibility to the findings in the future.
Once again, we are Group 1B from ESN 3F. Thank you for listening.